is a community-based organization as well as a trust, and it implements integrated health services with a major focus on family planning, encompassing ecological awareness for the environmental conservation.
Ecological awareness is being sensitized to your environment around you when you want to plan your family. If you want 6 children, have you got enough resources to enable having 6 children, whether that be livestock, school fees, water? That all is encompassed into CHAT's family planning.
Family planning is a service that is offered to women to give them options of planning their families according to the resources that they have. That includes spacing the babies that they have and negotiating with their husbands the number of children they have to bring up to ensure that they have quality life.
Our relationship with CHAT is that we are partnering in provision of health services. We have the family planning component, the TB/HIV care component, and of course, they are also partners in outreach services.
Before family planning awareness, which CHAT brought across, traditionally, there before here in this community, they believe that if you have so many wives and so many children, that is wealth. 3 wives, 8 children, each wife. That is a big population in one family. There are so many limited resources whereby they cannot even cater for their children, because there before they used to have enough milk, there was enough space for grazing. They are not getting enough for these families.
They also go and cut trees for their firewood and charcoals. That means they are going to clear the bushes and the trees that can attract the rainfall. There is no farming going on where they can substitute the livestock together with the farming due to lack of rain. Women have to spend a lot of time looking for water. They have to carry the water on their backs, and they waste a lot of valuable time which they could have done economic activities that would bring income to them. So eventually you find the families and the children are malnourished. They don't get balanced diet to eat, and they eat 1 meal per day, and people live below $1 in a day.
Health facilities are very far, so it puts these people in a big problem.
Because these people are very poor, and some diseases such as TB and HIV are quite debilitating. And actually, you give somebody drugs alone without food. Sometimes things don't work out well.
Community Health Africa's mandate is to provide free family planning to as many of the people they can reach. We use a strategy we call backpacking. We do have a very small team, 2 nurses and a driver, with a motor mobile, and that goes around approximately 23 unserved or underserved communities a month. We also, on about 4 times a year, they go out for about a month at a time, camel mobiles. That's obviously to more the nomadic, more remoter communities. Apart from the motor mobile, it's all door to door.
We talk to women, we talk to men, we talk to elders, trying to give them a lot of information as in family planning, as in HIV awareness. So we talk to the larger community.
The beaded girls in Samburu community, this is a girl who is given some beads or a bead necklace by a young man.
They are lovers of the Samburu Moran and occasionally even an elder. They can be from 10 years old onwards. They produce a child, they're unmarriageable. So that results in a lot of unskilled abortions and desperately infanticide.
Nikapewa shanga, lakini nilikataa kutoa hiyo msichana yangu, niliambiwa sababu hiyo mtoto anaweza kunisaidia baadaye.
They end up even sometimes bleeding. They can even easily die. So that's why women are so much in problem.
We offer family planning contraceptions that prevents them from getting impregnated by the Morans, and that will give them smooth time to continue having their sex with a protection until the time of their marriage. So we ensure that the beaded girl does not get unwanted pregnancy to undergo all those sufferings by accessing contraceptions to these beaded girls.
Kenya's population is growing at a vast rate. 60% of Kenya's population today is under 24 years old. Another 60, if not 70%, are unemployed.
That leads them to migrate to other countries, especially in Europe, in US. So if we intervene at this level, that will lead to manageable population of the country. We will reduce the migration from Kenya, and we will maintain our resources to ensure there are adequate jobs for the people we bring up.
Wildlife is going to an extinct because of the increase of livestock and people. So it's really affecting this community. If we get enough funding, we'll be able to reach everyone to alleviate the suffering of the underserved communities, like, for example, Samburu County, Samburu community, and so many others, so as to see them having a very good living standard.
So contraception is a magic potion for so many ills. And it enhances a lot of traditions too, if they can access contraception, because not all traditions are bad.